Welcome back to News 46. Well, sepsis is a common and potentially life-threatening manifestation of infection affecting millions of patients worldwide. Sepsis can also be difficult to diagnose. A new study summarized the findings of an international group of experts who set out to update the previous definitions of sepsis. They also describe a more streamlined way to recognize patients with sepsis so that treatment can be started more quickly.
This health tip is brought to you by
Desert View Hospital and Mountain Valley Physicians Group. Don't put your health on hold. We have time for you. Call us to schedule your appointment. 775-751-7100.
As soon as you get an infection, the body starts responding to infection.
Sepsis is when the body's response to infection injures its own tissues and organs.
Doctors Christopher Seymour and Derek Angus from the University of Pittsburgh School of Medicine and co-authors summarized the findings of an international task force who updated the definitions of sepsis. In a related study, they reviewed the electronic health records of more than 1 million patients to assess the usefulness of a clinical score known as SOFA, used to identify patients with sepsis.
SOFA behaved very well, especially in ICU patients. But a lot of the time, outside the ICU, you haven't done all the measurements for a full SOFA score.
The task force also identified something new called the Q-SOFA, or Quick SOFA, which can be used as a clinical prompt at the bedside for doctors and nurses. This uses only vital signs, such as altered mental status, low blood pressure, as well as difficulty breathing. 2 of those will identify a patient most likely to be septic.
If you have an infected patient that scores 2 points or more on Q-SOFA, you should be worried about that patient. In more austere settings where you can't get the blood tests, this may actually be a very practical tool.
Sepsis is difficult to recognize. The task force provides us with these criteria, so this helps doctors and nurses recognize sepsis quicker and get treatment started right away.
We expect and look forward to it being improved. We want to see iterative change over time, and we hope that using data to validate the definitions is ushering a new era. We've been trying to help come up with simpler rules that will help promote early, simple, easy identification of patients to then prompt early and appropriate intervention and management.
Catherine Dolf, The JAMA Report.
Sepsis carries an enormous public health burden, accounting for more than 5% of total U.S. hospital costs.
The disabled American veterans continuously lend a helping hand to other veterans and the community itself. And here's how you can get involved.
We reach out to the community. We are veterans helping veterans. And to do that, we try to serve our comrades, our communities, by reaching out, helping, but we also do educational outreach. We'll have information booths at various events to where we tell people who we are, how we can help, that kind of thing. Ken, do you want to add something?
Well, what we do also is we help those that are less fortunate than us as far as the veteran community. We work with certain organizations throughout town, some of which are the VFW, the No to Abuse, ARMS. Pastor Ron is a person we reach out to. We reach out to a Mr. Dale Ledman over at Salvation Army. Catherine and I, on occasion, go out in the desert and distribute water to those on those hot days. They've turned my house into a food bank / clothing store / furniture warehouse. So when we run across veterans in need of any of those items, I try to dig around in the garage and see what I can come up with. On occasion, if we give out food, then we follow that up with a list of the other food banks and try to show the veterans how they can budget their money as far as food is concerned.
How do we reach out if we want to volunteer or contribute or anything like that to the DAV?
You can contact me. Terry has some business cards that he can hand out that give you information on our chapter phone number. Our chapter meets the 3rd Tuesday of the month at the Nye Communities Coalition Building, the Activity Center. and it's at 5:30. We welcome guests. We'll give you a couple of business cards on our way out, and you'll be able to have that. And we'd welcome you to come and visit and see what we're all about.
And do you take ongoing donations throughout the year?
Yes, we do. We are also planning our Forget-Me-Not distribution, which is coming up the second weekend in May, that Friday and Saturday. This is where we reach out to the community. We hand them a Forget-Me-Not flower, and we tell them what that's all about and what disabled American veterans do to try and help veterans in the community. And it's a wonderful program because, again, we also have the opportunity of reaching out to the community and sharing with them, and they can see what we're all about.
News 46 caught up with a group whose mission is to keep trails open here in our state.
Backcountry Horsemen is an all-volunteer organization, and we solely exist to help keep trails open to pack and saddle stock all over the U.S. It's a national organization, so we're one chapter of 3 in Nevada, and it's all volunteers. We have 143 members right now all over southern Nevada, just our chapter personally, and we work up in the Spring Mountains with both the Forest Service, the BLM, Fish and Wildlife, and other organizations that have like-minded interests to keep.
Is there a threat to the trails being closed and not accessible?
There's a threat to the trails being closed simply because the government agencies keep getting cut back and they just don't have the staff to keep them open.
And so how do you guys actually get feet on the ground as far as getting them keeping them open?
We have approached all the agencies, and basically our approach is, what can we do to help you maintain or build trails so that equestrians can keep using them? And right now we've had a very good response here.
Have you been working here in Nye County too?
A little bit, but right now their main focus is on the east side of the mountain.
How can people get involved?
People can contact us. They can look us up on Facebook. It's the Bristlecone chapter, Bristlecone just like the trees on the mountain, chapter Backcountry Horsemen of Nevada. And they can also go to our webpage, our website, which is bchnvb.com.
As we head into our break, News 46 wants to hear your thoughts. Nevada ranks 50th in the nation for education ratings, and Nye County is the lowest ranking school district in Nevada. Do you think there's something that could be done locally to improve our school district's ratings? Tell us what you think. You can call the Your Opinion Matters line at 727-9400, extension 209, or leave it on our Facebook page, facebook.com/News41.